Well, telemedicine is now a reality. It is revolutionizing everything from making a doctor's appointment to developing vaccines and diagnostics. Our next panel takes a peek into the future in the age of digital health. Joining us right now is Lauren Gardner, Associate Professor, Department of Civil and Systems Engineering, Johns Hopkins Whiting School of Engineering, Nandan Nilekani, Chairman and Co-founder, Infosys Limited, and Mike Wells, Group Chief Executive for Prudential. Bloomberg Television's Chief International Correspondent for Southeast Asia, Haslinda Amin, will moderate. So let's go first to Lauren. Lauren, how do you see this? What is going to be the role when we think about digital health going forward? Because it definitely did pick up some momentum during COVID.
Hi, thanks. Yeah, it's a great question. I think that if there's anything that we've learned this year, it's really the value of information and the value of publicly available information. And so as someone that's been leading the Johns Hopkins dashboard, where we've been tracking coronavirus cases from basically early January, I think there's no question that there was this huge untapped demand for this kind of desperation for real-time information from the public, alongside the audience that we knew needed it, which is our research community, the public health community. And so making that kind of information available and making sure that there's an underlying infrastructure and system there to do this, so that when these kind of events occur, whatever they are and whatever is causing them, that information is available to anyone that wants it, so that it's not only available for actions and decision makers to be using to help guide how to address these situations from a policy perspective, but I think at the same time, we really want that information available to all the individuals so they can make better decisions on their own.
Well, and I have to say, we have definitely lived by the Hopkins data, and I think the world has certainly, and certainly here in the United States, to kind of get a good snapshot of where we are. Nandan, I want to bring you into this because, this is your world, and taking a look at increasingly how technology is impacting everything that we do. And I think things like telemedicine, which were so slow in coming, all of a sudden there are more and more people doing it. How do you see it? What will be the digital impact when it comes to really healthcare globally?
Well, I think what we are seeing in healthcare is actually what we are seeing across the board, which is the dramatic acceleration of digital adoption. We are seeing that in e-commerce, we are seeing that in education, and certainly healthcare also. And there are a number of facets to this. One is, of course, telemedicine or remote consulting, where people are actually going online using some kind of a video conferencing platform to talk to the doctors and get some advice and so on. There's also been a dramatic rise in online pharmacies, where people are buying their drugs online, especially when they have chronic medicine and they want to get it much cheaper. And also, I think the vaccination is going to create a whole new opportunity, because we are going to have billions of people getting vaccinated in the next few years now, with the phenomenal progress we're seeing on vaccines. And every one of them will need a digital vaccination certificate, which they can carry around with them when they travel, to show that they've been vaccinated. And if you think of the digital vaccination certificate as the first electronic health record for people, then suddenly we have several billion people who in the next 2 to 3 years will have electronic health records on a starter level. So I think the technology, digital health has been impacting everything: telemedicine, online pharmacies, electronic health records, and of course the whole extraordinary pace at which the vaccines are getting developed. The underlying stuff is all digital. The whole genome sequencing was done within a month of this virus. By January, we already had the genome sequence. So I think the digital pervasiveness is everywhere.
And you've called it a WhatsApp moment for healthcare, Nandan. I want to bring in Mike. Mike, for a company that's about 170 years old, it must have been quite a pivot.
It was, but we were about 2 years into a project to an end-to-end digital health ecosystem that has an artificial intelligence doctor, telemedicine, some of the things we're talking about, pharmacy delivery, all those sorts of capabilities in Asia. And I think there's a couple of things. I agree with the previous speakers. There's 2 or 3 major trends. There's I think most people you run into, even socially, have a view now of what medicine can and can't do. And so there's a much more honest conversation with stakeholders on capacity and the role of patient, the role of provider, the role of payer, if that's a government or doctor, and then policymakers moving quickly for the, feeling, all of them feeling aligned with COVID to do things differently. And again, that's created some amazing innovations, as I've already been mentioned, but it's also created uh, an intersect of the digitalization that you've seen in Asian health, right, with the established markets, primarily physical, traditional delivery models that are going very digital for a variety of reasons. But all of those stakeholders, patient, provider, payer, policymakers, all of them have moved massively through COVID, and I think all in the right direction. And the fact that Asia started someplace very different than the Western markets, is putting them on a different trajectory than, say, the U.S. or Europe. But they're all using the same tools that have been discussed by the other speakers.
In the end, it is about data. Lauren, we talked about your COVID dashboard. Its success shows just how poor access to real data has been. What lessons have been learned in terms of how to collect, how to provide, how to share data so it is better the next time round?
Yeah, we're absolutely still learning those lessons every day. I have lots of strong feelings about the way that information should be made available and communicated and shared. So by far, our biggest challenge with this whole effort, which is, on an hourly basis, we're pulling about 10,000 variables from 3,500 different locations around the world into this dashboard. And we're doing this in a world, in an environment where there is no standardization in place for what this data should look like. And, we're focused for that particular dashboard on case and death data and recoveries, which is a whole nother ball game. But these aren't the only important variables, and they don't tell the whole story at all. And the standardization issues get worse when you start talking about things like testing positivity rates. And so by far, the thing that needs to be in place is more standardization for exactly what variables should be reported, how they should be reported, in what formats, in what data structures. They need to be publicly available in real time, machine readable, because we can't go around and check all these websites and enter the data manually into some spreadsheet and upload it. So I think that making sure that this kind of information, which I understand, it isn't necessarily something that has to contradict any privacy concerns at all, because what we're collecting is anonymized, aggregated level data. And there's a lot that can be done with that. And so I think it's just having a culture and a system in place so that that's always available in a way that's usable.
So it remains very challenging, Nandan. What's the role of the private sector in advancing this digital healthcare? Where do you see, the biggest advancement that can be made?
No, I think the private sector has a huge role. I mean, governments have to define policies, set standards, data privacy rules, and so on. But a huge part of the delivery of all these things will be done by the private sector. Mike talked about what they're doing in Asia, a program called Pulse, which has done very well. And I think private sector has a huge role. And I think to Lauren's point, I think we now need to start looking at standardization of the vaccination process, because so far the focus has been on testing, cases, recoveries. But as we start vaccinating, we'll also need a lot of real time data from around the world, especially because many of these vaccines have been will go in with emergency authorization. So we need to very quickly figure out which ones are doing badly, which ones are having side effects. And that's all data. So I think having learned the lesson about the standardization in testing and so on, I think since the vaccination is still a few months away, it's a good time to start thinking of standardizing vaccination data so we have a much better grip on how it's being rolled out globally.
Mike, for you, what data are you collating for the markets you're in, like Asia, like Africa?
Yeah, so we're very careful on leaving the client health data with the client. And so to Lauren's point, it's aggregated data on policy, and we share that with the ministers of health and things in the countries we're working in. But again, it's at a level that's anonymized. There are challenges. I mean, there's two things Lauren said I'd strongly agree with. One is people want to know this. We've had 12 million downloads of this app in Southeast Asia, basically since end of November last year. Now in 10 languages. I think they are using the tools. One of which was developed in the UK, Babylon, which is a artificial intelligence doctor in the UK. You can replace your GP with it, and it was built off the NHS's database, which is, if you think from a researcher point of view, quite unique because it's an entire country's health records. So there's some incredible quality of research that can be done on that. So a solution from that market going into these other markets as a symptoms checker, and if you're in Southeast Indonesia and the closest doctor is 2 hours away, do you take the day off work or not? Those sorts of decisions are now made on someone's mobile device, which I think is tremendous. The challenge, though, that's coming, and it's telemed, pharmacy things, the doctors, is consumers really like the telemed experience, particularly our Asian clients, and it's efficient and it's safe. But data is not allowed to move across markets in most countries in Asia. Often the consumer doesn't own their health data if they've been to a hospital in certain markets. So there's got to be a standardization of policy around what the client can and can't keep, what's portable, what's transferable, and whose licenses, say, as a medical provider, work across borders. But there's discussion on that now. And again, these are the kind of discussions that are more frequent because of COVID.
Lauren Nandan, this one's for you. Lauren will go first. It's about breaking data silos to encourage innovation. How do we do that?
That's a good question. I think a lot of that can come from the fact that we need data from so many different types of sources. And so if we can come up with some kind of better mechanisms and structure and system and standardization, then ideally this can be adopted across the board. And so I want to echo something that was already brought up. And we've been thinking about for months, for at least 6 months, is when vaccines come out, it's going to be so critical to understand how those are getting out and getting adopted and deployed and what impact they're having. And there's going to likely be multiple vaccines, and they might each have different kind of targeted audiences. And we are waiting to be able to collect that data. And unfortunately, we have no idea how that's going to show up, who's going to provide it, the quality of it. And this goes all the way up to things like if there was another pandemic or infectious disease that started tomorrow. We've built this whole infrastructure over the last year, and unfortunately, a lot of it isn't even directly transferable to another infectious disease because the system isn't in place. So I think you need all of these different players that are contributing information that's relevant for the same problem to be working together and understand that the data needs to be provided in a certain way, in some systematic way, so that it can be useful.
Nandan?
Well, I think when we look at data, there are different parts of it, right? One is there's the whole aggregate anonymized data with which you do surveillance or trend analysis and generally that kind of stuff. And then there is the individual's personal data, which often has to be private. And one of the things which has been developed in India is the concept of account aggregators, which are essentially an architecture that allows individuals to take charge of their own health records. So they can get their health record from their hospital, from the provider, from their drug agency, from the testing, from the specialist. And then they can take that data in a portable manner and give it to somebody else to have a look at. So I think ultimately the health records will have to be built in a way that individuals are empowered to take their own data and move it around. So portability, interoperability is very important. At the same time, we need to be able to extract from that mass of data, anonymized data for trend analysis and other medical purposes. And of course, that data should also be used in an anonymized way for AI purposes. So I think there's different ways to look at the data. But clearly, we have a massive need for standardization. And I'm worried that the vaccination will again have the same issues. There'll be no standards, and everybody will be doing it differently. And we won't be able to really collate everything together very well.
we'll pick up on standardization slightly later, but right now I want to take a look at regulation because it is one of the issues that needs to be looked at. Governments everywhere were already working on new rules to facilitate digital healthcare even before COVID 19. Now it's been expedited. How far has regulation caught up with technology, Nandan?
Well, I think there's a tremendous effort right now to catch up with technology. We saw that in the vaccine development. I mean, the way they were able to compress the vaccine development to less than a year is precisely because regulators responded to the situation. They started giving emergency authorization, concurrent evaluation, a whole host of things to crunch time. So I think one of the big things that COVID has done has made regulators also extremely aware of the time consequence of their actions, and therefore, I think regulators around the world now are moving far more swiftly, far more agile, far more flexible. And I think that's a great thing, not only for this COVID, but in future also as we face other medical challenges. The resilience and flexibility of regulators has become a big positive.
And Lauren, is there true disruption in how governments are reacting to new technologies in healthcare?
I think it's hard to answer that because it's so different country to country. I mean, it really depends. Our experience working with different countries, trying to collect information and communicate with them and understand what the real situation is on the ground is really challenging and varies pretty dramatically place to place. So I do think there's a broad recognized need for this kind of regulation, and I think in some places it's being better developed and implemented than others. But I do think there's still kind of quite a bit that needs to be done in most places.
And Mike, isn't it true that we have strict regulatory environment for safety and efficacy standards? So we have to go slowly, in effect.
I think we have to be careful. I don't think the slowly is. If you think about if we'd have asked Lauren's team to look at 10,000 pieces of data every she said hourly. If you'd have said that amount of data 10 years ago, how many hours would it take you to process a million pieces of data? It would have been a very different period of time than it is today. So I think the infrastructure to process information for policymakers has accelerated as it has for private companies and as it has for consumers. And one of the trends that's behind a lot of the consumer adoption, I think, of digital is the ever increasing capability of the mobile devices. I mean, 5G on the horizon now in most markets, and suddenly things take an entirely different feel to them. An even higher level of gamification and things coming. But from a policy point of view, I deal with a lot of policymakers across Asia and both health and finance, and they're all concerned about health inclusion. They're all concerned about financial inclusion. They see the two intersecting, and there's a lot of push for us to stay with their policy ambitions, as well as for a challenge for us to make sure that the privacy is right, the quality, the interaction. But we don't have a market, for example, that during COVID the regulators haven't allowed our agency, bank, or digital channels to sell in a format like we're talking today. So those approvals are we're all within a few months. So I think they're being very active. I think they're very challenging. There's some very unique models, across Asia. We have regulators that have investments in tech firms. In the case of Singapore. So I mean, there's some very sophisticated regulatory looks at digital, and I don't do a meeting with a policymaker where it isn't a major part of the agenda, and they're pushing us to include more of the population. When we launched in Malaysia, for example, they wanted assurances in the government that we would include the bottom 40 at no cost of the population to the technology we're rolling out. That's a great role for us, and I'm glad to do it. But that's the sort of dialogues that are occurring, and I think they're committing a tremendous amount of resources to staying with digital solutions in both finance and health.
The thing is, Mike, is that technology is evolving so quickly, you almost need a more flexible framework of regulatory environment. Is there a fair assessment to make?
Always true. And I think you cannot write a policy that regulates ethics at the end of the day. I mean, people are going to do the right thing. or they're not going to do the right thing. And I've watched this across most of my career with financial innovations things and health innovations. They can and should expect private sector players to behave appropriately ahead of regulation. And you see retroactive regulation in lots of markets when that hasn't happened. You see the consumers wanting personal liability of leaders when they've done things that socially we think are wrong. I don't think you can expect the policymakers to envision every use of every tool that technology can create. I think they can set standards and they can hold expectations high and they can expect transparency from companies and then have the infrastructure, the bandwidth to measure and look at what we're doing. And that's been our experience to a great degree.
Nandan, earlier you talked about global standards. Where are we on global standards? What are the risks given the lack of consistent data privacy standards and storage protocols?
Well, I think I think at the pace at which things have changed, we don't really have standard. But I'll give you a simple example of something which I think we should have a global standard, which is the a digital vaccination certificate. Now, why is this important? Because if we want to vaccinate billions of people very quickly, we also want them to have a portable, interoperable, verifiable certificate which they can carry with them, either on their phones or on the cloud or on a hard copy. Because we want people to start traveling, start moving, going to the airport, going to a new country, and everyone will be asked to prove that they have actually been vaccinated before they are allowed into the restaurant or the country. And therefore, having a interoperable digital certificate would be a great standardization that we can do. So I don't think we need to think about everything, but even if we can bring in, and already the WHO has international health regulations, but they were last updated about 12, 13 years back, and they were not really designed for the digital world. So just focusing on a digital health certificate, which is a global standard, interoperable, portable, authenticatable in real time anywhere, itself will have a dramatic impact on reviving the world economy and society post-COVID vaccinations.
How realistic is that, Lauren? I mean, it's so fragmented. If we can't agree on whether to wear a mask or not, I mean, what are the chances that we can agree on data privacy issues?
I want to be optimistic about it, but yeah, I think it's a huge challenge because I think that even getting a country to do it, and I mean, the US it's complex in itself, right? We have data that we need to be standardized, not only from the national level, but also from the state level and also from the county and city level. I mean, in the US alone, we have 3,200 counties and they're doing things differently. So it's hard to think that we can expect 200 countries who have very different priorities and resources to all be on the same page, but it's really important. And there are some basic things that I think this can be managed for. I mean, just in terms of notifying publicly when certain types of things happen and doing that in a certain way. But it's a huge challenge, and I'm not sure who's in the position to enforce it.
Mike, your take on it as you navigate the different markets that you operate in?
Yeah, no, I've been in, I was just counting, I've been in 6 countries in the last 3 months. I think I've been tested a dozen or more times. And, to the point where I see that stick coming at me and I shake a little bit. I think there's the bizarre thing is you hand them a piece of paper, right? As you enter these countries and you go into quarantine. And so the current alternative to a digital standard is an 8.5 by 11 or an A4 sheet of paper that says this testing center says I'm okay. From a data integrity, a fraud, a risk point of view, it's just not acceptable. We've got to do better than that. And I think the other one that you see that we haven't brought up is, and there's quite a discussion I think in the U.S. more than the markets on this, is contract tracing. So I have multiple apps from different countries that ask you to have contract tracing when you're there. When I'm in the States and I'm talking to friends, a lot of them think that's a very bad idea. That yet they have no issue with social media platforms, Google, Apple, etc., prompting their consumer needs based on their location and their web search activity. So there's a social buy-in to this that's different in different countries. But I could not agree more on his comment. I think we have got to quickly get to a better standard or a handful of standards on this sort of health passport idea, because the idea that I can, I bring a piece of paper with me that an immigration officer or health officer is supposed to understand as a hospital in the United States or the UK is to me a standard that just isn't acceptable. We can do better than that.
So Nandan, how do we bridge the different attitudes, the data privacy between East and West, for instance?
Well, just to focus on the vaccination certificate, I want to make 2 points. One is the world already has the concept of interoperable vaccination certificate, and that's already embedded in the international health regulations put out by the WHO. For example, when you visiting a country in Africa, you have to go with a proof that you've taken the yellow fever vaccination, which you get done in your own country, and they gave you a certificate which you then show at the airport when you land. So the concept of a vaccination certificate which is interoperable across borders is already there in our global society. What I'm saying is we now need to make that a digital certificate so that we can carry it on our phones or on the cloud. The second thing is that a vaccination certificate has no privacy issue, because I actually want to show you that I'm vaccinated. Unlike, it's not about privacy anymore, because it's actually about my vaccination certificate helps me to go somewhere else. It improves my life. It helps me to do my job. So I think people will be very proud to show their vaccination certificates whenever they travel. I don't see a privacy issue at all, especially with vaccination certificates.
I want to take the discussion forward, look into the crystal ball. The pandemic has exposed flaws in almost every single healthcare system in the world, but it's also radically revolutionized telemedicine. I mean, what will be the next phase of digital health? How will it look like? Lauren.
Well, one thing that I think is obviously going to be a component of it is going to be all of these immediate access to publicly available information. I just don't really foresee a world ever again where there's any kind of regional, national, or global kind of health crisis that happens where the information on what is going on isn't available in a really accessible way to anyone that wants it. And so I think that's, one of the biggest things we've learned here. And while there were institutions in place that were providing this information before, they were doing it at different scales that maybe weren't as actionable, or they were making the information available in ways that weren't really as accessible and usable to just kind of the common individual. And we found that those are the people that really need the information to have it, to act on it, or making that same information available equally to everybody, and making sure that it's transparent in terms of where it's coming from.
And Mike, Lauren talked about how we should make it available for everybody, a more equitable society, digital healthcare for a more equitable society. How do we get there? What are you doing in terms of your own initiatives?
Yeah, so I think it's you are not going to have effective societies if you don't have reasonable levels of health inclusion, right? Start with that as I think a basis for this. So an artificial intelligence symptom checker or doctor, if it's in the UK, can do two things. It can provide effectively at no marginal cost, if you will. It can give an individual the ability to do a basic checkup and then forward that data accurately to a telemedicine provider or then to a traditional provider. And in that process, they get to the doctor sooner or don't go if they don't need to. It's a bit of a triage element. It manages the finite capacity we have in traditional care. And to be clear, the emerging markets and developed markets have huge capacity issues, as COVID's laid bare, right, on healthcare. We have increased the number of people in Asia that can afford healthcare. We've increased the number of people in the US, for example, that are available to healthcare. through the Affordable Care Act, and we haven't materially increased the number of doctors and nurses and hospital beds. Now, you are seeing great expansion of infrastructure in some countries in Asia, but again, not keeping up with the demand. So the proposition has to change between the consumer, the access to the provider, right, and the complexity of it. And it was brought up earlier, digital wallet. There's tremendous inefficiency and ineffectiveness in people going from doctor to doctor. If you think of all of us have probably had the experience of taking an older parent or someone you care about to the doctor because the conversation is complex and they need an advocate in the room to make sure the message from one appointment to the next carries over. That's all easily done digitally. So I think the experience changes and it's for the better.
We have very little time left. I just want to get to our polling question. And the question is, which tech would most effectively improve quality of life? A, 5G-enabled telemedicine. B, wearables and personal health monitoring tech. C, genetic and diagnostic analytics using AI. And D, mindfulness and meditation app. Very quickly, Lauren, your choice.
I think the wearable tech, only because the third one doesn't seem possible without collecting that information in the first place.
Mike?
I'm going to say the third, but I think wearable tech for the growing challenges we're facing in Asia with diabetes and so that's going to be a big breakthrough, I think, in that space. So I think both to me would be even. I know that's not a definitive answer, but I think solving two different issues: general healthcare, the third; wearable tech for diseases like diabetes, which are a major concern post-COVID.
And Nandan?
I would go with the 5G telemedicine, mainly because I think in many of the countries, many people don't have smartphones and they don't have connectivity, and therefore wearable tech works when you have connectivity where you can transmit what's happening. So, I mean, in the long term, yes, but in the short term, 5G telemedicine is my choice.
A vibrant discussion. Nandan, Mike, Lauren, thank you so much for joining us today.